Part 2. This video will talk you through tasks and responsibilities you may face in the role and how to manage them.
The types of care that Moral Care provides is entirely variable depending on the person's needs. Our care packages are completely person-centered. We provide what it takes to keep someone safe at home. That can mean anywhere between companionship and a cup of tea, to more complex packages such as end-of-life care. You can expect to deliver personal care tasks, falls prevention, washing and dressing, medication administration, companionship, preparing food and fluids, running errands, monitoring welfare, continence support, reablement, catheter care, moving and handling, domestic and shopping support, pet care support, and more. All you are contracted to serve the community of Morecambe and the surrounding areas. This is anywhere from Overton to Beare to Hestbank and the surrounding districts. You have contracted shifts so that you can have a positive work-life balance with guaranteed minimum to maximum hours. This is to offer you financial security. The reason you have variable hours is that exact shift durations can slightly vary depending on the clients we have on at the time. Shifts run anywhere between 7 a.m. to 2 p.m. and 2 p.m. to 9 p.m. and you will be scheduled within those timeframes according to your shift schedule. If you are on a double shift, our care navigator will make effort to ensure you have a longer break in the middle of the shifts, so you can have a moment to breathe. Other companies offer exact hours, but you never know each week when or where these hours will take place, meaning you can never have a life. Some companies offer set shifts, but 0-hour guarantees. Moral Care offers the best of both worlds, so you have guaranteed hours and a predictable working pattern. You know when you'll be working this time next year, and can also relax knowing your bills are always going to be paid on time. If a time comes in your employment where you would like more hours or an adjustment to your shift schedule, please come to the office to request different working arrangements. We will always work with you wherever we can. If your circumstances change, it doesn't mean you need to resign to find another job that can accommodate your new need. We may be able to accommodate, but we cannot look into this unless you communicate this to us. Don't ever struggle in silence. The rotas will be published on Friday at 5 p.m. at the latest, in accordance with your shift schedule for the following week. Exact visits and times may be adjusted in the event of an unexpected event, such as a short notice staff absence emergency, a service user being discharged from hospital, a new package starting, or if another carer has been held up at another job and needs jobs reshuffled or resourced. This will always be within your contracted shift times. Some carers can become fixated on where service users live in relation to one another and become frustrated when runs don't appear to always run in idealistic chronological order according to clients' geographical locations. We make strong efforts to keep visits in extremely tight proximity bubbles, but sometimes this isn't always possible due to unavoidable legal obligations. For instance, if a service user went into hospital and created large gaps in your rota, this work would be replenished by visits that perhaps isn't in your usual area to ensure your contracted hours are upheld. Another example could be if another carer is on a back-to-back run and legally needs a break, one of their visits may be removed and implemented onto your run if you have the availability. This may mean that you have a service user who seems geographically odd compared to your usual bubble, but still within your allocated area. Other things that could impact idealistic runs are service users refusing mails, 2 new staff scheduled on a complex double-up that they aren't confident enough for yet, or new service users needing specific times to meet their needs. We wouldn't refuse someone a care package if we have the availability, just because they weren't next-door neighbours to the people directly before them on the run. In this image, the arrow lengths represent the travel time between properties. It doesn't matter if your visits are in a geographical line like this, or if you go back and forth like this. The travelling is no different whether you went from Heysham to Westgate to Beare, or if you went from Beare to Westgate and back to Beare again. Try not to focus on this, and understand there is usually a reason for this. Avoid being territorial on certain roads or areas. Remember, You are contracted to work in Morecambe and the surrounding areas, not to specific service users, villages or streets. You are also paid for travel time and mileage covered. The Care Navigator creates runs to try to balance the client's needs, carer's convenience, and legal obligations. Your convenience is very important to us, and we do tell service users to have a degree of flexibility, so carers don't have gappy runs. But you too need to be expected to have a degree of flexibility in return for when service users' locations don't fall in an idealistic way which cannot be prevented. PPE, short for personal protective equipment, is crucial for maintaining good infection control practices. Good infection control protects both you, as the carer, and the service user from harm. PPE has two primary uses. 1. To protect the carer from harmful substances such as handling medication or cleaning products. 2. To protect the carer or client from viruses, illnesses, pathogens, and bacteria. Gloves should be worn at all times on visits due to the risk of viruses harbouring on surfaces in people's homes. Gloves should be changed between providing personal care, medication, and preparing food. White aprons should be used for personal care such as washing, dressing, disposing of commode matter, and changing continence pads. Blue aprons should be used for cooking and preparing food. Eye protection should be used when there is a risk of splashes from harmful substances. Hand sanitizer is available to use between tasks or when hand washing stations are not suitable or available. Sanitizer bottles should be clipped to your lanyard and can be refilled in the office. Masks should be worn when someone is especially vulnerable or if there is a risk to the carer or service user of an airborne infection such as C. diff, COVID or flu. Masks must cover both the nose and mouth. If you have any issues with PPE, you must report it. You cannot purchase your own PPE as we have certain criteria, such as requirements for the specific types of materials used in the gloves. You must come to the office to top up your PPE stock as needed. Make sure you're equipped over the weekends, for the office is closed. PPE is single-use only and must be correctly disposed of after use. PPE should be disposed of in an outdoor bin and sanitizer used once PPE has been removed before getting back into your vehicle. Make sure not to accidentally litter any gloves or masks onto people's paths or driveways. PPE is stored in these boxes, kept in the waiting area at the office. Keep an eye on fluid intake. Older adults face a higher chance of dehydration. Watch for confusion, dizziness, dry mouth, dark urine, fatigue, and headaches. Dehydration can quickly lead to hospital admissions and complications. Hydration improves physical health, maintains blood pressure and circulation, supports kidney function, helps regulate body temperature, prevents constipation, reduces pressure ulcer risk, supports immune system function, reduces the risk of infections, improves cognitive function, promotes better healing, and, most importantly, overall, reduces hospital admissions. Always make sure you document when you provide fluids and observe satisfactory intake. Alert the office if you feel someone is not drinking well so we can take action before the service user becomes poorly. You must always offer or serve fresh drinks to every client you attend. Ensure correct texture modifications, normal consistency, pureed, minced or soft. This will be in the person's care plan. Never rush someone with swallowing difficulties. Position them correctly for safe swallowing, not reclined. If anyone is struggling to swallow and regularly coughing on food or drink, report this to the office straight away, as this indicates they are at risk of aspiration. They will need a referral to SALT. SALT stands for Speech and Language Therapy. They are in charge of assessing people's swallowing and prescribing the correct food and fluid textures. Aspiration is when something you swallow enters your airway or lungs. Food or liquid entering the lungs instead of the stomach can cause aspiration pneumonia. This is a serious, potentially fatal condition that's entirely preventable with proper texture modification. Liquids that are too thin or solids that are too lumpy are common culprits. People with swallowing difficulties are usually prescribed a thickener. This thickens the consistency of fluids and prevents the person from inhaling thin fluid. In your role, you will also be preparing various foods for our service users. You must ensure that you follow the manufacturer's instructions exactly to prevent food poisoning. Food must be presented in an appetizing way, and kitchens cleaned whilst in use and afterwards. Changing PPE is necessary. Documenting what a person eats is very important. It evidences that we aren't neglecting people. You must not just document what you have served, but also whether they have eaten anything or evidence of eating. You could document that you have made someone food, but that doesn't show they are eating. You could make them food for them to just look at it. It's critical you monitor and document their consumption. Whilst in the kitchen, it's good practice to observe for out-of-date foods and seek consent to dispose of them. Any opened food should be labelled with the date of opening. Otherwise, other carers won't know how long it's been left open. Note someone's appetite changes and alert the office if there's a change in this. You must also monitor for significant weight gains or losses, as well as identify any coughing on food. This could indicate they need to reassess their swallowing abilities. Coughing is a sign of aspirating food or drinks. Sometimes food can go down the wrong way, and it can be nothing, but if it is a continuous event and a regular occurrence, you must report it so the office can take the appropriate action to refer. If you think a person is choking, remember this rhyme. Loud and red, let them go ahead. Silent and blue, they need help from you. You don't want to physically intervene if someone is simply coughing when eating because something went down the wrong way, as intervention may cause the object to become lodged and create a choking incident. Act when they show signs that they cannot breathe, cough, or talk. If in the rare incident someone is choking, silent, blue, and needs immediate intervention, give 5 sharp and harsh back blows between the shoulder blades and lean them forward. This causes vibration that can dislodge the blockage. If this fails, try abdominal thrusts by holding the person from behind, putting your arms around the person with locked fists and pulling sharply inwards and upwards just above the belly button. If this hasn't been effective, call 999 on loudspeaker and repeat this cycle. Remember, when someone's life is at risk, life is more important than limbs. Don't focus on not hurting the person. The focus is about saving the person's life. People can repair a broken rib, but cannot repair a lost life. Please note that this is not a regular occurrence whatsoever, so don't be alarmed, but be prepared to act should this ever occur to a service user, or even your own loved ones or friends. There may be other occasions when you need to ring an ambulance. You would need to do this if someone is unconscious, has severe bleeding, chest pain, difficulty breathing, stroke or heart attack symptoms. If you aren't sure, the office or on-call staff are always available to advise and support. Performing a basin wash. Prepare warm, soapy water in the sink or bowl as preferred. Test the temperature with your elbow to prevent scalding someone or bathing them in uncomfortable cold water. Gloves can mask the true temperature of water. Wear your white personal care apron and gloves throughout the procedure. Have clothes and clean towels at the ready. Being unprepared could cause the service user to be cold and exposed. Start with the eyes and face first, then work your way to the dirtiest part of the body last for good infection control. Ideally, we would like to use a separate flannel to wash intimate areas. Be careful not to get soap in the person's eyes. Avoid taking away the person's independence. If appropriate, ask if they want to do their own face and hand them the flannel. This makes the person feel empowered and capable. Thoroughly dry each area as you go. Make sure to wash one area, then dry it before moving on to the next area. Washing someone all at once and leaving them wet longer than needed will cause them to feel cold and uncomfortable. Concentrate on washing eyes, face, armpits, underbreasts, understomach, back, groins, legs, feet, and sacrum. This provides an opportunity to discreetly monitor these areas for breakdown, rashes, pressure sores, and wounds. It is crucial to ensure that each area is thoroughly dried. Any area left damp may lead to a moisture lesion, particularly under the breasts and stomach. When drying a person, don't harshly drag the towel. It's best to pat and dry delicately, as older people's sick is fragile. Dignity first. Close doors and curtains for privacy when providing personal care. Cover areas not being washed. Don't leave the person exposed and vulnerable unnecessarily. Always imagine how you would feel in this scenario and keep the areas that aren't being washed covered up. Ensure that people are dressed appropriately and have dignity maintained. For example, if you find someone has fallen and you find them naked, make sure they are covered up and presentable for when paramedics arrive to prevent the person feeling embarrassed. Always communicate and explain each step and ask about comfort and water temperature. Documenting care notes what was done in detail. Don't just write "done" in the task prompt. The more you document, the better protected you are. Done doesn't tell us if you helped them, what you washed, if they did anything themselves. Once you have completed the wash, change your PPE before changing tasks. Never leave someone alone in water. Run the bath, using appropriate washing and soaking products. Check the temperature of the bath with your elbow before allowing the person to enter. Remember, your gloves will mask the true temperature of the water. Use non-slip mats and grab rails where available. If they can wash any part themselves, encourage this independence. Your role is to assist safely, not take over completely. Always explain what you're doing and ask about their comfort throughout. Remember, they feel more awkward and exposed than you do. Create a relaxing environment and make them feel comfortable and at ease whilst they are so vulnerable. Before helping someone dress, check their care plan for any mobility issues, weak limbs, or specific clothing preferences. Gather all clothing items and lay them out in order. Ensure the room is warm and private. Maintain dignity by only exposing the area you're working on. Always explain what you're doing and encourage them to help as much as they can manage. Always put the weak or less able arm or leg into clothing first and remove it last. This prevents strain and injury to weakened limbs. For example, if someone has a weak left arm from a stroke, put their left arm into the sleeve first, then their strong, maneuverable right arm last. When undressing, remove the strong arm first, then the weak arm last. This technique protects vulnerable limbs and makes dressing much easier and safer. Choose clothing that's easy to manage. Avoid tight-fitting items or complicated fastenings where possible. Monitor the hygiene of a person's clothes. Sometimes older people have poor vision that can't see stains, or have a lack of awareness and capacity, or loss of sensation that prevents them from identifying when they need to have their clothing changed. Changing a continence pad. Before starting, gather all supplies: clean pad, disposable gloves, wipes, disposal bags, and barrier cream if prescribed. Wear clean gloves and a clean white apron. Ensure privacy by closing doors and curtains. Explain what you're doing to maintain dignity and respect. Ask any friends or relatives to leave the room. Remove the soiled pad by rolling it inwards to contain waste and spores. Then clean the area gently with wipes, working from front to back to prevent infection. Pat the skin dry and apply any prescribed barrier cream to prevent soreness. Use this opportunity to check for any pressure sores, redness, or skin breaks. There are different pads people use. Some might be slip-in pads to use with nets, pull-up pants, or sticker strip pads. Do not refer to the pad as a nappy, as this is degrading to the person. Remember, these are adults and not babies. Position the clean pad securely, making sure it isn't scrunched up, as this will be uncomfortable and not as effective. When you have removed the pad, document the outcome of any bowel movement and urine passed. If they haven't passed urine all day, you will need to notify the office immediately. If they are constipated or have diarrhea, consider treating this with prescribed medication. If they have none prescribed, alert the office to make the referral. Alert the office any pain or discomfort the person experiences. Dispose of the soiled pad, wipes, and gloves in appropriate waste bags. Never put them down the toilet. Used pads should be disposed of by double bagging. If you find that a person is continuously wet beyond the pad's capacity, it could suggest that the person isn't wearing the correct pad to meet their need and should be reported. Always treat continence care with sensitivity and respect. Maintaining dignity during intimate care is essential to preserving the person's self-esteem and trust. We pride ourselves on being different than the rest. We don't flit in and out of people's homes as fast as we can. It makes a huge difference to make sure service users are left tidy, such as making sure their clothes are clean, their teeth are in, they are clean shaven, their hearing aids are in, and their hair is brushed. The curtains are open, and the beds are made tight and neat, and the home smells nice. This shows relatives and other professionals that we are doing a good job. Care is expensive, and they don't want to pay a lot of money to visit their loved ones looking like they're unkept. Make sure you take pride in leaving people and their homes, just as you would expect if it were your own mother or loved one receiving care. For every visit, make sure that all pots that are not in use are washed, dried, and put away. Ensure sinks and draining boards are left clean and tidy. Nothing screams "we don't care" more than a sink of stale pots. Also, remember to regularly replace the washing up sponge or cloth for good infection control. Sponges and dishcloths are a breeding ground for bacteria. Catheter care. A catheter is a thin, flexible tube that's inserted into the bladder to drain urine when someone can't empty their bladder naturally. As care workers, we provide basic maintenance only, no invasive procedures. You will be expected to change the day drainage bag weekly, attach and remove night bag extension, secure the day bag properly to the leg, and observe for any unusual sedimentation or blockages. At the top of the leg, there must be an anchor strap. This is the strap that protects the catheter from being pulled or dislodged, and is arguably the most important strap. The strap is securely holding the catheter tube at the connector point. Holding the tubing in this area means that the tubing can't slip through and pull the person's bladder, no matter how heavy the catheter becomes. This correct placement will ensure the point of entry is safe from trauma and protected from being accidentally snagged or pulled. This is what the straps should look like when they are all correctly fitted and secure. The securing anchor strap at the top of the leg to stop the weight of a full bag pulling the bladder down, and 2 support straps at the top and bottom of the bag to hold the bag in place on the leg. The straps have rubber on the back of them to prevent slipping. This means you don't need to attach them too tightly. This is what the setup should look like when the night bag extension is attached to collect all the urine overnight. Make sure to remember to open the valve on the day bag so that the urine can flow through the leg bag and collect into the night bag extension. And remember to mount the night bag on a stand. To empty the bag, push the tap down and drain the contents into a jug, preferably a jug that has measurements on the side so you can document the exact urine output of the bag. The same jug should be used for this and never used in the kitchen again. Clean up any accidental spillages. Failing to do this will cause a permanent unpleasant odour in the person's home. Have some tissue at the ready to capture any drips at the end of draining. Make sure you have closed the tap back up when reattaching it to someone's leg. Forgetting to close the tap will cause urine to pour out on the person's ankles and floor between visits. Attaching the night bag. The night bag is not a replacement for the day bag. The day bag is known as the bag attached to the person's leg during the day. Sometimes people refer to the day bag as the leg bag. The night bag is an additional bag attached to the day bag, which acts as an extension to capture high amounts of urine overnight. This night bag extension is attached at night time and removed in the morning. When attached, ensure that the connection is secure. The key to successful nighttime drainage is to ensure the tube does not flow up, as shown in this clip. Urine cannot flow up, and the tube must work with gravity. Ensure the tap is open between the day bag and night bag connection so that urine can flow through to the extension freely. It's a good idea to leave a small amount of urine in the bag to test that urine is flowing into the night bag extension as expected. However, do not drain the entire contents of the day bag into the night bag, as this will take up precious space. Night bags are single-use only and should be disposed of in the morning. Make sure to document how much urine was collected overnight. Night bags should preferably be mounted on a night bag stand. Night bag stands can be moved to ensure no circling or kinks, and straight tubes directly to the bag. They ensure the tap doesn't touch the floor and remains clean. Night bag stands also allow for the bag to expand as it fills. If a bag is left on the floor, it isn't able to expand effectively, which could risk urine flowing back up as it would have nowhere else to go. Changing the day bag, also known as the leg bag. Once a week, the day bag should be completely disposed of and changed, replacing it with a clean, fresh, sterile day bag. This is to reduce the risk of sediment buildup in the tubing. Simply unplug the day bag from the connector point and plug a new one in, being careful to keep the connector clean and facing up to prevent urine drips. When you do this task, write the date of the bag change on the back of the bag, so it can be tracked when the last time a day bag was changed. The orange tap is for district nurse use, where they come and perform weekly flushes. This is where they squeeze a sterile solution into the tube to flush out and break up any sediment buildup. This task is not within our remit as care workers. If you still aren't sure about catheters after this video segment, please write this down on your training paper now. Then once this training session is complete, one of the office team can take you to the training room to do physical catheter practice. Some visits you complete include a focus on companionship. When you're on the go all the time, it can be quite strange to stop and talk when we're so used to being on our feet and busy all the time. But some people's care plans specifically include companionship, which is just a general chat to make them feel listened to and less lonely. If someone has companionship on their care plan/tasks, make sure you make extra effort to chat to them and see how they are, rather than focusing on rolling up your sleeves and getting on with the more physical tasks. If there's time, it's always okay to sit down with service users and have a cup of tea and a chat. Oral care. It's important to monitor oral health and support as needed. Some people have their real teeth, which should be brushed twice a day. Some people have dentures. Dentures should be removed and soaked in a denture pot overnight, preferably with a Sterident tablet for freshness, and brushed before putting them back in place in the morning. Some people wear support stockings that can appear very, very tight. This is to medically support them with circulation, aches, and fluid retention. There are lots of different aids available to help apply them, and lots of different types of stockings. These usually come with step-by-step instructions on the property to follow. You must be careful when applying stockings to not causing skin tears. Urine infections, also known as UTIs, are common in older people. Symptoms are cloudy urine, offensive smelling urine, acting out of character, struggling to urinate, mood swings, and acute confusion or hallucination. If you spot any of these symptoms, report it immediately, as urine infections in older people can develop rapidly and lead to life-threatening sepsis if left untreated. Throughout your role, you'll be continuously monitoring a person's physical welfare, which includes checking pressure areas, bruises and skin tears, and body mapping them. Older people are more prone to these, and we must always observe and take action as needed. Bruising may indicate physical abuse. Pressure sores could indicate neglect. Skin tears, redness and rashes may need an urgent medical referral, so it's important to document and alert the office. When body mapping, always seek consent where possible and document that you have obtained consent for the photo attached. If they don't consent to a photo, you can still submit a body map but say they didn't consent to the photograph. Where possible, photographs are very effective because we can see what intervention is needed and share it with their medical teams. When you take a photograph, make sure they are as dignified as possible, making an effort to avoid inappropriate or unnecessary backgrounds of other intimate body parts that could be avoided. When taking a photo, always ensure that the photo is taken through the app directly. This ensures that no inappropriate images are stored on your device. Doing this would breach GDPR and be unlawful to store vulnerable images on your personal device. Older people are at high risk of pressure sores, and once a pressure sore has developed, it can be very, very difficult to heal and can cause great suffering. It is our duty of care to protect them from these developing. Prevention is always better than cure. You should promote regular pressure care to all service users and encourage walking or repositioning. The most vulnerable service users to pressure sores are those who don't mobilise often or are bedbound or chairbound. It's encouraged that service users should have pressure cushions, which are special cushions designed to distribute weight evenly and prevent pressure sores, and to apply barrier cream to those with vulnerable areas or delicate skin. The most vulnerable and common pressure areas are the buttocks. Pressure sores start as an area of discoloration. Then the skin breaks and forms a small ulcer, which will then grow in size and depth, sometimes down to the bone. We want to catch them very early on, from the discoloration or minor skin break. Other pressure areas are any areas that are subject to long-term pressure, which causes restricted blood flow, such as elbows, ankle bones, back of head if in bed, or any area in long-term contact with a surface. People in bed need to be repositioned completely every 4 to 6 hours to regularly rotate their pressure points. Other common problematic areas to observe are people's lower legs. Cellulitis can be common in the lower leg and shin area. If this area becomes red and hot to the touch, the person may need to start a course of antibiotics, so body map it if you see these symptoms. Another common skin complaint is bacterial rashes in skin folds, such as under the breasts, groin, under the stomach fold, and loose skin areas. It's important to pay attention to these areas and make sure that these areas are patted thoroughly dry when washing and not left wet. These areas are usually moist and dark and can easily result in a nasty bacterial infection. This would be characterized by red skin, odor, or split skin. If you spot this, report it right away so they can commence treatment. Scabies is a skin condition caused by tiny mites that burrow under the skin. It's highly contagious and spreads through close skin-to-skin contact, which means we're at risk when providing personal care. The good news is, it's completely treatable once identified. What should you be looking out for? The main thing is intense itching, especially at night. Look for small red bumps or a rash, particularly in warm areas like between fingers, wrists, elbows, armpits, around the waist, and genital areas. You might also notice thin, irregular lines on the skin. These are the burrow tracks the mites make. What action should you take? First, don't panic. If you suspect scabies, make a note in your care records immediately. Don your PPE and contact the office straight away. We'll need to inform the family and arrange for the GP to assess and confirm. Meanwhile, maintain your usual infection control, wash your hands thoroughly, and if you've had prolonged skin contact, let us know so we can monitor the situation. Shingles is caused by the same virus that causes chickenpox. If someone's had chickenpox before, the virus can reactivate later in life as shingles. What should you be looking out for? The classic sign is a painful, blistering rash that typically appears on one side of the body or face. It follows the path of a nerve. Before the rash appears, your service user might complain of burning, tingling, or sharp pain in that area. The rash starts as red patches, then develops into fluid-filled blisters that eventually crust over. It's often described as extremely painful, more painful than itchy, unlike some other rashes we see. Watch for fever, headache, or general feeling unwell alongside the rash. What action should you take? Document everything immediately and contact the office straight away. We'll arrange urgent GP assessment as early treatment can reduce severity and duration. Important safety note, especially for pregnant carers, shingles can be contagious to people who've never had chickenpox. If you're pregnant and haven't had chickenpox, you must not provide care to anyone with active shingles. Contact the office immediately so we can arrange alternative cover. This is for your safety and your baby's. For everyone else, avoid direct contact with the rash, use gloves for personal care, and maintain excellent hand hygiene. Older people with fragile skin may also be prone to skin tears. Skin tears can easily happen when brushing past an object or catching an item on the skin. If you find someone has a skin tear, clean the area with clean water and gently push the skin flap back across so it can heal and re-knit. that is, if the skin flap is still intact. Put a suitable dressing/plaster on to protect it, whilst being mindful not to put the adhesive too close to the loose skin, as this might pull the skin off when the plaster is removed. Take a photograph of the wound before you perform first aid, and report to the office before covering, so the district nurses can be informed and redress as necessary. If anyone has any other cuts or grazes, you must perform first aid, making sure the area is clean, and cover with appropriate dressings where available. Do this after you have taken a photograph and body mapped the wound. You may visit someone who has fallen or falls whilst you are present. The most important thing to remember when someone has fallen is do not attempt to pick them up, even if they ask you to. You could injure yourself or the service user. The first thing you must do is remain calm. The person will feel very panicked and scared, and if you show you are worried, it will make them feel even more frightened. First, assess if they have injured themselves, and if you need to call an ambulance, for example, if they have hit their head, are bleeding, have broken something, or have chest pain or breathing difficulties. If they don't appear injured, the next step is to see if they can stand up by themselves. You could put a chair by them to see if they can pull up on it, or help guide their legs into positions so they can push up. If they cannot stand, you will need to call the Falls Lifting Service, which will be on their contact list available to you. Notify the office as soon as possible so your rota can be adjusted accordingly if needed, and the office can begin to contact relatives to come and sit with them so you can move on once you have handled the situation. Ensure they are comfortable and dignified while they wait for help. This could mean covering them up with a dressing gown or blanket and putting a pillow under their head. If someone is stuck mid-fall or falls whilst you are on a visit, it's best to control the fall and support them to the ground. Rather than take their weight and try to prevent the fall, it's better to get them on the ground safely. If they are stuck in an awkward position, such as by the side of a chair, it could be better to put a pillow behind them and move the chair so they can safely lie on the ground until help arrives. Some service users are smokers. Service users have every right to smoke, but they must not smoke whilst you are on visit. If you arrive and a service user is smoking, ask them kindly to extinguish their cigarette so you can enter or wait outside until they have finished, but make sure they know it will count as their visit time. Even if you're fine with people smoking, it's important to follow this policy so that it doesn't vilify other non-smoking colleagues. We could have pregnant or asthmatic colleagues who should not be expected to be exposed to active smoke. Carers must not purchase cigarettes for a service user. As we work with doctors, nurses and other professionals, there may be times when we are needed to monitor someone's blood pressure. The normal range for blood pressure is 120/80. Anything above 180/120 needs urgent medical attention. You must use the correct procedure to take someone's blood pressure to ensure an accurate reading. Attach the cuff to the mid-upper arm and ensure the tube is positioned to the center of the inner elbow like this image. Make sure the person is sitting down and not talking or fidgeting if possible. Sometimes clients may want you to fill a water bottle for them. It is company policy to use hot tap water only and not boiled water from a kettle to prevent scalding and burns. You may only use a hot water bottle if it is in date. If you look at a hot water bottle's neck, it shows you the date of when it was manufactured. This image shows that the hot water bottle was manufactured in the 4th segment, which represents the 4th month, April, and the number in the middle is the year it was made, 2021. Hot water bottles shouldn't be used after 2 years due to rubber degradation. If a service user wants to fill and use an expired hot water bottle themselves, we can advise them, but not stop them if they have capacity. But carers must not use it or support the use of it. People with dementia and older people are at high risk of fire. As a carer, you must make a conscious effort to maintain fire safety. Our supervisors will check that the fire alarms are working every 2 months, but you must report anything that you think is unsafe or fire hazardous, such as paper or cardboard close to a heat source, oxygen near a fire source, candles with a service user with memory loss, electrics draped near water, frayed wires, daisy chain electrics, etc. Older people cannot evacuate from a fire as well as we can, and can detect it later than we do. So, we need to lower the risk of a fire as much as possible. Shutting doors is a good habit, as it can contain a fire should one break out. There are other risks to watch out for, such as fall risks, injury risks, needle stick injuries, slip risks, etc. If you experience an accident or a near miss, you must report this to the office straight away so efforts can be made to keep you safe and to prevent other accidents and incidents. It's important to think consciously when visiting someone with dementia. Is it hot? Open a window. Is it cold? Do they have enough layers on? Are they in bed at a strange time? Are they aware it isn't nighttime? Do they have dirty clothes on? Do they need your help to identify this and change? Sometimes it's up to you to identify the needs of people with dementia and not depend on them to tell you. Are they struggling to hear? Perhaps they forgot to put their hearing aids in? Sometimes service users will want to give you gifts at Christmas time, your birthday, or just want to show their gratitude. In the interest of protecting our service users from exploitation and coercion, you can only accept gifts that are less than £10 in value and not sentimental, such as a cheap bottle of wine or a box of chocolates. You cannot accept any cash, regardless of its value. Any gift you receive must be reported to the office to be monitored. A lifeline is a pendant that vulnerable people, who usually live alone, can wear. It's an alarm button that can be worn as a necklace or bracelet. They can press this emergency button in the event of a fire, fall, or other emergency. When living alone, it can be a lifesaver, because if they have an emergency, there's no one in the house to call 999 for them. Some of them are designed to detect falls, and some are even linked to fire alarms and will dispatch the fire service. If someone has one of these, it's important they wear them between visits, and don't just have them draped on a trolley or bedside table. They should be on the person at all times if they consent. Some people have a do not attempt resuscitation document in place. This document is known as a DNAR. When someone has this, it means that if you find someone who is unresponsive, you must not resuscitate them. People can have this document in place if they choose to, or medical professionals can implement it if they deem resuscitation to be too harmful to the person. Hospitals sometimes send people home with this document in a yellow folder. At Moral Care, they must be displayed in an easy-to-view place in the person's home, such as above their bed or on a cupboard, where paramedics and carers can get easy access to the document. If you cannot physically find the document, the resuscitation must commence. If someone is unconscious and you call emergency services, they will automatically start guiding you to resuscitate. If they have a DNR, make this clear at the start of the call. If someone has a DNAR, it will be on their care plan. Remember, you must be able to view, see, and touch the real paper document for it to hold up in the moment. So prepare yourself and become familiar with who has these in place. People who are very fragile usually have DNRs in place, as their quality of life will likely be poor if resuscitated. But some people may still wish to be resuscitated and not have one in place. You must legally resuscitate if there is an absence of a DNAR. This applies to us and all members of the public at any time. The need to resuscitate someone is an extremely rare event, but it could happen at any time, and not just at your workplace here at Moral Care. Don't worry, no one expects you to be an expert at resuscitation. You aren't a paramedic or a resuscitation practitioner. Just remain calm and call 999 and follow their instructions if resuscitation is required, just as you would if someone collapsed at a shop. People we care for may progress towards the end of life and be cared for at home. Palliative care is different to other care types, as it focuses on making the person pain-free and comfortable and maintaining dignity in their final days, weeks, or months. Emotions can run high and relatives may need you more than ever to be an emotional support. Visits are no longer focused on providing meals and gaining weight and health. Visits become focused on providing comfort and working closely with the nurses to ensure a dignified and positive experience for the person. We don't often support palliative or end-of-life care, as we don't take on care packages that are at this stage, but pride ourselves on being able to offer this service to those who have already established trusted bonds with our team. The hearing is the last sense to go, so they can be in their most vulnerable state and be supported by their care team, familiar voices, and feel safe at home, rather than going to pass around unfamiliar people in an unfamiliar clinical setting. This is the toughest part of the role for the team, but also the most rewarding. The families you support at this time will remember your support forever. Remember to be sensitive on these visits. Try to avoid complaining about anything to make conversation, because they are going through a painful time, and nothing is as significant as losing a loved one. People who are receiving our palliative care services usually have a DNR in place. Make yourself familiar with its location, as there is a chance they may pass when you visit, and you want to have the situation under control when or if the time arises, and ensure a calm and controlled situation for yourself, the client, and their family. Palliative care is always colleague accompanied, so you will never be alone when navigating these situations. As part of our commitment to holistic, person-centered care, our role often involves visiting service users who have beloved pets. These animals are not just animals, they are cherished family members, and we must treat them with the same respect and kindness we extend to our service users. Key guidelines. Every pet will undergo a comprehensive risk assessment before visits. If a pet has a documented history of aggressive behaviour, the service user will be required to secure the animal before your arrival. Most of our service users have friendly, well-loved pets who are an important part of their support network. Our expectations. Treat all pets with gentleness and compassion. Do not approach pets aggressively or fearfully. If unsure about interaction, ask the service user for guidance. Report any concerns about pet behaviour to the office. Remember, a pet is often a service user's companion, source of comfort, and family member. Your kindness towards their pet is an extension of the care we provide. As part of our comprehensive personal care services, you are responsible for monitoring and maintaining the hygiene of service users' fingernails. Regularly inspect fingernail condition during personal care routines and clean under nails thoroughly using gentle techniques. When nails require trimming, soak fingers in warm water to soften them. Carefully trim nails using nail clippers and ensure smooth edges to prevent scratching. Toenail protocol. Carers are not permitted to cut toenails. If you observe long or problematic toenails, immediately report to the office. The office will arrange a referral to a professional chiropodist. Long toenails can impair walking comfort, increase infection risks, and cause potential mobility issues. By maintaining careful nail hygiene, we prevent discomfort, reduce infection risks, and support our service users' overall well-being.
You're not just starting a job, you're beginning a calling that will transform lives, including your own. Every day you'll step into someone's home and become more than a carer. You'll be their therapist when they need encouragement, their advocate when they need a voice, their friend when they feel alone, and their safety net when they're vulnerable. You'll be the reason someone can stay in the place they love most, their own home. The elderly gentleman who lights up when you arrive because you remember he loves talking about his garden. The lady with dementia who feels calm in your presence because you speak to her with dignity and patience. The family who can finally sleep peacefully knowing their loved one is in your capable, caring hands. This is your opportunity to be part of something extraordinary. At Moral Care, we don't just provide care, we restore hope, preserve independence, and create moments of joy in people's most challenging times. Remember this, you will get out of this role exactly what you put into it. Bring your whole heart, your compassion, your dedication, and you'll discover a career that doesn't just pay your bills but fills your soul. You have the power to make every single day better for someone who needs you most.